and welcome to all the truth seekers that have joined us today. I'm glad that you've decided to join this online community and hope you're ready to inhale some provocative insights that will inspire and change the way you do business. My name is Mark McKelsey, and I lead the people and the projects that bring you insights, shopper trends, and next practices from Global Market Development Center Retail Tomorrow. For the next hour, this infocast will make your lunch hour profitable by demonstrating just how the curiosity and the power of the consumer must be at the center of your strategy. In other words, the way you've done things in the past is not the way your future success will happen. Retailers and brands, more than ever, must be adaptive and in constant flux in order to connect with evolving populations. So, how you respond to this session is important. Without further ado, let's jump into it. I'm coming to you live from Colorado Springs and have Jose Zelstra from Gender Fair, Tom Ashworth, and Keith Akins, both from CVS, joining us today. Today's infocast is about how business development and human resource experts need to know that the term diversity and inclusion is more than just a modern buzzword, but it is necessary for a solid business strategy to emulate across all functions inside your organization. Research proves that internal and external business practices that include diversity can improve company and deal morale, strengthen employee and customer loyalty, attract more talent, and in the end, foster a greater degree of community that can be used to boost public relations. In other words, diversity and inclusion is no longer a feel-good term. It can have effect to your bottom line. So that means our topic today is well aligned, in case you didn't know, with the 100th anniversary of the 19th Amendment that takes place this month. That amendment was the constitutional right for women to vote and marked the passage and beginning to open up democracy to a greater degree and expand throughout the history of the United States. At that time, we still had a long way to go, but that was the spark this country needed to begin to open doors to greater recognition of equality. We've come far, but as we all know, there's still a long way to go and a lot of work to be done. In fact, a study by McKinsey in 2016 showed that Western Europe today had only 17% of executives are women and 32% make up the composition of corporate boards. Here in the US, on home soil, the results are even lower. Similarly, 17% of executives are women, but only 19% of women have seats on boards. Again, according to Harvard Business Review, who supports workplace diversity and corporate inclusion and say that they're one and the same, says not only will these principles of inclusion result in a widening talent pool for most companies, but engagement rates inside an organization are increased while turnover is reduced. And I'll give you a quick quote. I found this really interesting as I was reading that report. It says, the Harvard research finds that employees with inclusive managers are 1.3 times more likely to feel that their innovative potential is unlocked. Employees who are able to bring their whole selves to work are 42% less likely to say they intend to leave their job within a year. Those with sponsors are 62% more likely to have asked for and received a promotion, while 69% of women who off-ramp would have stayed at their companies if they had more flexible work options. So that study is very insightful, especially for today's infocast. It's clear that today's modern and contemporary organizations understand well that success is predicated on a change in values, both inside the company and who they associate and deal with on a day-by-day basis. That means everything from the staff who designs products to those who make and market them, all the way to the C-level suite, need to pay attention to the modern demographics that are rapidly changing and reflect the makeup of the population at large in order to remain connected with the consumer. So, here to tell us more, Jose, welcome. Would you let our viewers know what they can expect to learn today?
Thank you, Mark. We're very excited about this infocast. But before I begin, I think over the past 6 months, society has experienced unprecedented change due to COVID-19 and the civil rights unrest. And such changes have led to significant uncertainty at the intersection of health, economics, and society. Within the current landscape, business leaders need to do more than just survive. And companies that want to thrive need to make diversity and inclusion a strategic imperative. CVS provides a great example of such an organization that has responded well in this challenging environment, partly because of its long track record of investing in its employees and communities. We will learn about the innovative steps CVS is taking during this time and the importance of supplier diversity in the organization. And lastly, we will provide an overview of Gender Fair as it relates to our partnership with GMDC and how we can support its members in diversity, equity, and inclusion efforts.
It sounds great, Jose. I'm very excited about this new partnership that Gender Fair has with GMDC Retail tomorrow. So back to our audience, before we get started and dive in, I'd like to remind you that our viewers we'll take questions from our viewers during or after the session. Just use the Q&A button at the bottom of your screen. Please don't use the chat feature. The Q&A is where we will be taking the engagement from our viewers. We'll get back to those at the end of the hour. So in the meantime, feel free to load up those questions. So let's get started. Back over to you, Jose, as you tell us about Gender Fair and introduce our guest from CVS that will enhance today's session from a practical view in the eyes of one of the most innovative and consumer-centric retailers in the world.
Yes, Gender Fair and GMDC have forged a new partnership in order to provide its members with services and support around diversity, equity, and inclusion in the workplace. And even before the current economic crisis, GMDC was recognized the importance of diversity as a strategic imperative for organizations. And during this past year, we've been able to formalize a way to bring our services as a benefit to GMDC members and at a discounted rate. And we all know that consumers are increasingly looking to shop their values and are seeking more transparency from organizations, whether it is how products are produced, its treatment of animals, fair trade, and labor, including diversity practices. But before I tell you a little bit more about Gender Fair, I'd love to take a short poll. Who is responsible or accountable for diversity, equity, inclusion in your organization? We typically find that, and especially in larger organizations, that they have a dedicated chief diversity officer. But increasingly, and as you see in some of the results, that the chief executive officer taking a greater responsibility and ultimate accountability for diversity, equity, and inclusion. So this is very much in line with our research. And in terms of Gender Fair, we have created a standard based on the UN Women's Empowerment Principles that's informed by research and top experts. And we've identified the most critical levers for workplace equality. Our metrics are grouped into 5 categories that offer a holistic assessment of a company's investment in fairness as it relates to gender and diversity. And over the past 5 years, Gender Fair has rated 5,500 publicly traded companies along these metrics, of which less than 20% are Gender Fair. And during our independent research, we've uncovered many best practices within and across organizations that have helped many of our clients along their journey. And for privately held companies, we provide assessments that are opt-in and confidential, and results are only published at the company's discretion. So let's take another poll. What are your top challenges when it comes to diversity, equity, and inclusion in your organization? Although many organizations are starting out with training, we do find that even a standalone initiative is not sufficient, and that diversity must be baked into the DNA of the organization. If we move to the next slide, I can talk a little bit about our services before introducing our CVS guests. As a trusted independent third party, Gender Fair can help organizations in many ways. We assess organizations' progress along diversity and inclusion, providing action plans and implementation support that accomplish concrete progress immediately and sustainability over the long term. Additionally, we assist in culture assessment and transformation, leadership training and coaching, and we provide, as mentioned before, industry benchmarks and best practice. In terms of creating a community, Gender Fair promotes organizations and leaders that are the standard bearers in diversity and inclusion, so that others can learn from their innovative practices. This is why today we're very excited to learn from CVS about how it leads in this environment and all the different ways where diversity matters. not only to survive, but to thrive. And hereby, I would like to introduce our guests from CVS, Tom Ainsworth and Keith Eakins. Tom supports CVS Health Strategic Diversity Management Enterprise Strategy, and Keith leads Diverse Supplier Strategy as a component of the company's strategic procurement programming. Thank you so much, Tom and Keith, for joining us today.
Thank you, Jose. Thank you, Mark, very much. It's a pleasure to be here today. All right. So, again, my name is Tom Ashworth, Senior Manager of Strategic Diversity Management, joined here by my colleague, Keith. And we're going to talk about, kind of some of the work that CVS Health has done over the last few months to counter a lot of the challenges that we're all facing on a day-to-day basis, both in business as well as in our personal lives. Greetings from Palm Springs, California, where it's going to be 118 degrees today, but fortunately I'm in nice air conditioning, so I shouldn't see too much sweat on my brow as we're going through the conversation today. So first I want to give you an overview of our company, CVS Health. We have a lot of different business units that you may or may not be aware of, so I want to make sure that you are familiar with those. We'll talk about our work around COVID-19, and how that relates back to our recent social injustice strategy that we rolled out in July. I'm then going to pass things over to Keith, who's going to talk about our supplier diversity and procurement process. But first, we have a poll for you. There we go. So as of today, how many CVS pharmacy locations exist? Great, good variety of answers there. So if you're like 71% of the United States population, there's a pretty good chance that you live within 5 miles of a CVS pharmacy. The answer is actually 9,938, so just under 10,000. And that includes our many brands across our retail side of our organization. Here you see many of those brands, many that you may be familiar with, some that you may not be. With more than 9,900 locations in the United States, our retail locations are committed to delivering innovative health solutions that create a simpler, more accessible experience for our patients, customers, and caregivers. Our pharmacy care teams provide trusted advice and counsel to help our patients get and stay healthy. Our CVS Yamas and Navarro brands serve the unique health and product needs of our Latino communities with over 300 locations in major Hispanic markets. Hawaii's Long's Drugs and our Target locations round out our retail pharmacy brands. We serve approximately 4.5 million customers per day at CVS Pharmacy. CVS Caremark is our pharmacy benefits management service. They help plan members manage their health in more affordable and effective ways. SilverScript is one of the largest Medicare-approved Part D prescription drug plan providers, serving more than 5 million members. And overall, our PBM serves nearly 102 million plan members. Our CVS Specialty Group is the nation's largest specialty pharmacy with 26 locations, serving patients with the most complex medical conditions, ensuring comprehensive patient care and controlled costs. Part of our PBM is our Accordant Health Services, a recognized leader in delivering disease management and case management services for people with rare chronic conditions. Hopefully at some point over time, you have stopped into one of our Minute Clinics. We have about 1,100 Minute Clinic locations within our retail pharmacies. Our nurse practitioners and physician assistants diagnose and treat minor health conditions. They perform health screenings, monitor chronic conditions, provide wellness services, and deliver vaccinations. To date, they served over 50 million patients. And within our clinical organization is our OmniCare team, a leading provider of pharmacy services to senior communities, long-term care facilities and assisted living facilities, and Quorum, one of the nation's largest providers of comprehensive infusion services. Finally, our most recent acquisition, founded in 1873, Aetna is committed to providing individuals, employers, healthcare professionals, producers, and others with innovative benefits, products, and services. With 23 million members, one of Aetna's priorities is to ensure that we're prioritizing programs that improve access, cost, and quality of care to our racial and ethnic minority populations. So this slide just outlines our overall purpose, strategy, values, and the imperatives. Everything that we do aligns back to our strategic imperative and then upwards to our purpose. CVS Health purpose is to help people on the path to better health by creating unmatched human connections to transform healthcare experience. I'm going to talk a lot today about the work that we're doing that is very local, how we're leading the change in our industry, working to make it as simple as possible to improve health of our communities. Real quick overview of some of the different partnerships that we have. We've been recognized for our outreach to communities through partnerships with both local, state, and federal partners. As a result, we've achieved many recognitions for our work, many of the most recent being listed here, including several which acknowledge our commitment to diverse suppliers, particularly our Tier 2 and Tier 3 partners. On the left-hand side in the box, just highlight some of our national partnerships that we do work around workforce, as well as marketplace initiatives. I want to mention too, as we move forward to the conversation today, our strategic diversity management objectives. As part of our SDM team, all of the work that we do aligns directly to one of these 4 quadrants or objectives. And when we partner with our business units, we look for these opportunities to be able to grow the business further. The first quadrant around workforce representation. We want to ensure our colleague demographics reflect the people that we serve. Is the pharmacist in that Hispanic community speak Spanish? Are the colleagues in that store or on the phone with our patients, are they familiar from a cultural proficiency standpoint with their patients and customers? Those are all the things that we look at. Inclusion and belonging. Is the workforce defined by personal connections, having a seat at the table, and genuine care for one another? We have over 15 colleague resource groups or employee resource groups, business resource groups that reflect different affinities, demographics, and ethnicities within the organization. They help us move the needle in terms of the work that we do around our marketplace diversity strategy. Talent systems ensures that we have equitable access to growth and development for all colleagues, ensuring that we have a mix of talent in all of our pipelines for leadership, as well as emerging leader programs. And finally, our diverse marketplace. It's critical that we provide exceptional service for those who depend on us, as well as each community in which we do business. So I'll kind of start out talking a little bit about our COVID-19 and community response. Over the last several years, we have, as much as America has realized, a major disparity of access to healthcare. This really came circle, I think, for all of us when considering the disproportionate number of COVID-19 infections and deaths amongst our particularly Hispanic and African American communities. The pandemic has revealed deep-seated inequalities in healthcare within these demographics. And while CVS Health, through our strategic diversity management and corporate social responsibility programs and partnerships, have worked to address these disparities, it's clear that there remains opportunities to address the injustice. The prevalence of underlying chronic health conditions such as asthma and diabetes, when coupled with the COVID virus, has pushed these populations to the brink, contributing to the enormous stresses of our healthcare system. But this is really nothing new, as this slide shows, as this data here is representative of 2016 health outcomes. Through our Aetna Medicare partnerships, research and analysis, this has become ever so clear. This slide highlights a perfect example of inequality within our multicultural populations when compared to Caucasian. This slide represents 2 examples, one in Philadelphia and one in Miami, where simple life expectancy differs based on the zip code that you live in. This demonstrates the critical need in implementing our Be Local strategy of engaging people with the care they need when they need it. The focus of our social responsibility work and operational strategies is around 3 main areas. Expanding our support of social services, such as our housing initiatives, to improve the lives of our community members, which in turn will result in aiding us in achieving the purpose of helping people on a path to better health. Collaboration with community-based partners, such as the ones in the earlier slide, is critical since they represent the most at-risk populations. These partners have boots on the ground to help extend our services as well as other resources within our communities. The priority of ensuring access to healthcare services is the most important component and the ultimate resolution in resolving our healthcare crisis, particularly with the risks of our current and future pandemic. We came to the realization at CVS Health early in the epidemic that we had the resources and skill set to address COVID-19 head-on at the community level. While uncertainty tended to overtake the national conversation, we were able to mobilize our stores to implement testing and education to our patients and customers, as well as through hyper-local nonprofits that could share our resources with constituents to ensure they were receiving the most targeted, culturally competent messaging about prevention. In no way is our intent ever to replace participants in our traditional healthcare system, but we could help them focus on the most critical cases and populations. We implemented this plan almost immediately and were able to provide testing in over 1,000 CVS stores nationwide by the end of May. One could question, our general approach to healthcare may have been misguided for much of our efforts in the past. We've tended to land most of our resources on the top of this triangle around clinical interventions, and then looking to help people sustain and maintain their treatments. However, there's greatest progressive focus on where the intervention should be to alleviate pressures on the interventions necessary at the moment. Early interventions, even before symptoms and conditions begin to establish, is key to the work we're focusing on in our pharmacies, clinic, and health plans. COVID-19 uncovered a blind spot in our healthcare strategy in the US, and CVS Health is in a position to positively impact the bottom of the triangle while intervening when necessary at the top. We've been able to address the needs of our communities in various ways through COVID-19, with emphasis on those that are most at risk. At the same time, it's critical we continue to promote and maintain healthy behaviors and preventative care. Two contributors to chronic disease that have been placed on hold in the healthcare industry so that resources can be designated to the greatest needs, even while we stay at home, immobile, falling into poor habits such as lack of exercise, nutrition, and medical, in many cases, financial resources. We've pivoted our priorities, often at the sake of making money. And as you can see, under each of these different sections, the first two, CVS Pharmacy and MinuteClinic, and then two, our PBM and health plan opportunities, are ways that we've been able to help impact our communities and businesses, partners at all different levels. Waiving home delivery charges, increasing access to 90-day prescription supplies, our e-clinic expansion and MinuteClinic, and most recently we've rolled out Return Ready for private and public organizations to choose who, how, and where to test employees or students via on-site testing and or drive-through testing. You may have seen the news this week that we announced a partnership with Delta Airlines to provide testing to their flight employees. We've done outreach to high-risk members to support a range of medical and social determinants of health needs, contacting them before they contact us. We've rolled out a resources for living support and resources to individuals and organizations impacted by COVID-19, whether or not it's part of their benefits. And Omnicare is working with several states to provide COVID-19 testing at long-term care facilities. In addition to bonuses to our frontline employees within our pharmacies, the hiring of 50,000 full-time, part-time, and temporary roles across the country was achieved in July. Many of these roles were filled by existing clients on our PBM who had to furlough workers, such as Hilton and Marriott. We also have an employer relief fund and opened access to our colleagues to providing short-term immediate financial relief in the form of tax-exempt grants. So looking at all these different ways that we can help impact our communities, both internal as well as external. So I mentioned our over 1,000 stores in which we do the testing of COVID-19. We've also opened up what we're calling community testing. These involve partnerships with local community organizations of no-cost walk-up sites for underserved communities. As we were opening up drive-through testing, both in our stores as well as in central areas, large metropolitan areas, we were discovering with our local, hyperlocal diverse partners that there was a population that was at risk that did not have access to these locations. Either they didn't have access to transportation to get there or didn't have access to transportation for the drive-up requirements. Testing in these locations was conducted inside the community site location, often churches, community centers, and individuals can walk up to access. On-the-spot results are provided. To be eligible for this testing, patients need to meet the criteria established by the CDC, in addition to our certain age guidelines. Now we're up to over 1,500 CVS locations, and we also have some large-scale drive-up locations in Georgia, Michigan, Rhode Island, Texas, and Arizona. So I'm going to do a little bit of a pivot here, as I've talked a little bit about kind of as we've discovered the need for community testing for COVID and been a leader in that area. We were very quickly able to adapt to the most recent social injustice challenges that began in the middle of May and are continuing on to this day. Last month, CVS Health announced it will invest nearly $600 million over 5 years to advance employee, community, and public policy initiatives that address inequality faced by Black people and other disenfranchised communities. The investment follows a commitment from our President and CEO, Larry Merlo, to evaluate how the company operates and how we can use its influence to be a force for good in communities across this country. CVS Health's investment will focus on improving employee experience, supporting communities the company serves, and influencing public policy. This builds on our longstanding commitment to diversity in many great ways. There's really 4 parts to our social injustice strategy. Colleagues in corporate culture, ensuring that we all have fair, equitable access to opportunities and advancement and development, including senior level positions. Ensuring our mentoring and development programs support advancement with a heightened focus on the experience of our Black colleagues. And then an amplified focus on our corporate culture and company-wide training that promotes active and purposeful inclusion. We have a workforce initiatives team that does work across the country, identifying career opportunities for in underdeveloped communities, persons with disabilities, as well as older workers. We're going to bolster those workforce programs to build on those already highly successful relationships, employment services, and training to those communities. We're going to partner with schools, universities, colleges, faith-based partners, and local and state federal workforce agencies to provide additional employment services and training to help bridge access to meaningful employment opportunities. In addressing health disparities and social detriments of health, expansion of our Project Health initiatives, and other investments to increase access to health focus. Our Project Health has for more than 10 years, free screenings in major metropolitan areas across the country in our CVS stores, mostly focused on Black and Hispanic communities. We're also going to heighten our focus and emphasis on increasing access to affordable housing, which we have proven to be inextricably linked to health. And then supporting and investing in our policies designed to get at the root causes of systematic inequalities and barriers in our Black communities. Finally, my colleague Keith is going to talk a little bit more around supplier diversity, but broadening our investments in our supplier diversity program, with additional focus on sourcing products from Black-owned and other diverse businesses by connecting, engaging, and networking with our suppliers, advocacy organizations, and corporate partners. And he'll talk a little bit more about building on our company's success and creating jobs and increasing our economic opportunities for our partners. I think this is a very important quote from our CEO and President, Larry Merlo, that the private sector must take action to get to the heart of institutional racism. As we learn from the perspectives of our Black colleagues and the diverse communities that we serve, we're going to use their input to inform our advocacy agenda and going forward. We have over 305,000 employees at CVS Health, and many of them have been able to give direct feedback back to Larry in terms of what they see within the organization, but, and what the work that we're doing externally, and give ideas in terms of how we can improve. Our Black Colleagues Resource Group has been instrumental in not only providing that feedback and perspective for our entire executive level of the organizations, all the way down to our store leadership and PBM leadership and other areas. They've opened up the conversation at CVS Health to really get at the heart of the meaning of the last several weeks and what that means, not only for the company, but for our country. So I appreciate you taking the time to listen to information I provide around our COVID-19 strategy, as well as social injustice strategy. And I'd like to take this opportunity to kind of lead over to my colleague, Keith Akins, who will talk a little bit about our supplier diversity initiatives. But first, I want to offer this poll to you. So what is the most recent reported dollar amount of economic impact generated through our supplier diversity program? All right, thank you. Another good spread of thoughts. It's actually $5.6 billion. So let me go ahead and pass the microphone on over to my colleague Keith, who will tell you a little bit more about our programs and how we serve our communities through our supplier diversity initiatives.
Thank you, Tom. I appreciate that. And it's a balmy 80 degrees here in Providence, Rhode Island. So just a tad bit cooler than out in California. But I want to wish everybody a wonderful afternoon. So we're going to go through a couple of slides here to kind of explain our Supplier Diversity program. We'll look at some of the impact that we've had on the community and kind of take you through our strategy and kind of some of the innovative ways we've had to get creative during this COVID-19 time. So what you're looking at here is the benefits of our economic impact report. When we went into doing our economic impact report, we wanted to see what kind of actual, how our program was economically affecting the communities which we deal. So when you look at this, the benefits of it, you look at the value, you have awareness, you have revenue generation, you have competitive advantage, and it's broken down. Each one is broken down. You look at the value as having an economic impact showcases the value of Supplier Diversity in our immediate, our senior leadership, our C-suite. We have extremely great support from our C-suite down. Now we're heavily involved with everything that's going on here recently. Supplier Diversity is actually one of the key goals in the pillars that you just seen. So I spend a lot of time with our sourcing and merchandising teams and making sure we're creating those opportunities for our diverse suppliers. When we look at awareness, our program is part of the $1 Billion Roundtable, which you see later on in some slides. Internal, external partners, we are ingrained in CVS Health. And now with our, with the acquisition of Aetna and some other acquisitions, our Supplier Diversity program continues to grow and prosper, and awareness is throughout the program with all of our groups, including, on the construction side, we're heavily involved. When we look at revenue generation, having an effective Supplier Diversity initiative may provide a competitive advantage within the health industry and attract and retain customers. That's important when you have we're looking at, almost 10,000 stores in different communities. A lot of people, they shop and go in the stores that are in the community, that have products on these shelves that represent them. And that's one of the things that we strive ourselves in trying to make sure that we want the products that's in our stores to reflect the communities that we're in. So that's a big part of the revenue generation. Competitive advantage, in some cases, consumers report spending more money with corporations that would focus on Supplier Diversity. We're actually in the midst right now, actually working on a Supplier Diversity impact report to actually show that, by having a Supplier Diversity program that increases foot traffic, that increases more dollars into the stores. So the economic impact report is really beneficial to what we do in our Supplier Diversity program. Next slide, Tom. So when we're talking about the program and you want to measure the impact of Supplier Diversity and the impact of our program, we look at it from the impact channels and impact metrics. You have corporate purchases, direct impact, indirect impact, and induced impact. And we're looking at corporate purchases. That's just the corporate purchases through the diverse business create a ripple effect in the supply chain. So it goes down from, we have our direct and indirect spends. So as we're looking at where we want to spend our money, where the opportunities are, and we're working with different parts of the organization to achieve that. Diverse business hire employees to support their sales. When you're looking at that, depending on what communities the store is in, you're hiring people from your community. You're hiring the citizens in your community. And again, it goes back to what I just said. We want our stores to reflect the communities that we're in. We look at indirect impact. Those businesses hire other suppliers, which create further jobs. So if we're hiring a merchandiser or we're hiring a packaging company in those communities, they're hiring people within the community. So we're even further going down the chain. Employees who support the communities through everyday purchases. So you're coming into our stores. That goes back, we're looking at the last slide talking about generate revenue. You're coming into the stores. You're coming to shop at CVS. When we look at the impact metrics from production, goods and services produced by suppliers and supply chain. Again, we're the products that are on our shelves is reflective of the communities that we're in. Same as employment, we're hiring within the community, income and community spending. You're spending money in our store is in the community. So as we're using diverse suppliers, and our focus now, shifting a little bit with African American suppliers, is making sure that we have African American merchandisers and products on our shelves within CVS. So we're constantly involving and constantly looking for diverse suppliers to have those products on our shelves. All right, next slide, Tom. So here we go. This is our economic impact report for 2019. So we have a third party company that actually puts this information together. As the polling question said, we see $5.6 billion production impact on our program. That's cumulative revenues of all businesses impacted through our program. So that number is a lot. I mean, we're really helping a lot of companies throughout the community, that we're constantly looking at ways to further that and further bringing on diverse suppliers, merchandisers. 35,746 jobs supported, and that's jobs supported within CVS Health's supply chain and then the suppliers' communities. We're creating job wealth. We're creating more work not only within CVS, but when we're bringing on these diverse suppliers and merchandisers, we're creating jobs for them. And one of the goals that I always preach and I always talk is we want our diverse suppliers and merchandisers to be economically viable long term, not just with us. We want you to be economically viable long term. If you can't do something with us, my job is to help you maybe do something with one of my colleagues and one of our competitors, because we constantly talk and we all need good suppliers. 1.9 billion wages supported. That's the cumulative earnings of the employees in the jobs supported through Supplier Diversity purchases. That's through the companies that I deal with directly, whether indirect or direct. We're a part of the $1 billion roundtable. I lost count. We just added one. Maybe it's over 20 companies that are part of the $1 billion roundtable. We're one of them. So we really take pride in the fact that we really go the extra mile and to make sure that we're using diverse suppliers within our supply chain. And then 2.2 billion small and diverse purchases. CVS Health spending with small and diverse companies. As you can see, we say and do what we say we're going to do, and we go out there and we strive to do it with everything that's going on. With our goals being a part of our BPC. Larry Malone very supportive. That we can't hide what we do. They look at it. Our goals are there. Our numbers are there. You can't make the $1 billion roundtable and not stay there. So we really got to do what we have to do to make sure that we're walking the walk and talking the talk. Next slide, Tom. So you may ask, why is supplier diversity important to CVS Health? Well, it's important for several reasons, and here goes 6 of those. You have economic impact, you have customer-based representation, innovation. We had to be very innovative during this COVID-19 times, competitive advantage, revenue generation again, and then cost savings. We just discussed the economic impact. When we look at the customer base, we want our products to reflect the communities that we're in. And we want them to see that when you walk into the stores that you see products on your shelf that are from women-owned businesses, from African-American businesses, from Asian-American businesses, from diverse businesses together, that you see that on our shelves. Innovation, understanding consumer needs, requires diversity throughout and thought talent. Through this whole COVID-19, when it hit in March, the first thing my team came and said, let's look for some diverse suppliers, because when it comes to masks, hand sanitizers, what you call it, the overalls that they wear, when you come up to the testing centers. We had a pipeline of diverse suppliers, and we were really looking at ways to create those opportunities and being innovative and finding those suppliers. And we created a very good pipeline of diverse suppliers. We work with national advocacy groups with the recommendations on suppliers to use. So we were real swift in when it hit and what we had to do to create those opportunities. Competitive advantage. In some cases, consumers report spending more money with corporations that have a focus on supplier diversity. Again, reflection on the community, letting the community know that our program is there, that we're working with suppliers, we're mentoring suppliers, we're growing suppliers, we're giving opportunities to suppliers. We touched on revenue generation. And then we look at cost savings. We found that diverse-owned business offer competitive pricing, often resulting in cost savings for us and to the end client. So a lot of times it's not all about let's go straight to the big guy. Let's go straight to the big guy. A lot of times there are some great mid-sized diverse suppliers to large to small suppliers that just need an opportunity. And that's one of the things we try to create that opportunity. And because they are, you know, middle-sized or small, so they're able to work with us and create that value add. And there are a lot of great and creative companies out there that come up with ways to show us cost savings, to have innovative ideas. Again, we're in a different time where those innovative ideas are what's going to push us and what's going to push them to the next level. So we're constantly looking at ways, and that's one of the biggest things. You know, I'm in the enterprise procurement group, and that's all I hear is, Keith, how can we save money? Cost savings, cost savings, cost savings. So when we're working with diverse suppliers, and that's one of the things we always tell them, hey, you're creative, innovative, especially now. The opportunity is great, is there, and we'll find a way to get you to where you need to be. The next slide, Tom. So what I'm about to kind of show or go through here is our Supplier Diversity Program strategic pillars. So we have 4 pillars. So everything that we do within our CVS Supplier Diversity team, I have a team, it's myself and I have 2 other folks. If it's not fitting into one of these 4 pillars, then it's kind of out of our scope. So when we look at supplier development and education, communication and program branding, community and industry relationship building, and performance and process management, we wanted to follow in one of these 4 pillars. Performance and process management, that's all of our reporting, that's all of our systems. We look at how we can improve our systems. That's all of our tier 1 and tier 2 reporting. Constantly looking at ways to improve that. Excuse me, community and industry relationship building. Events like this, conferences like this, opportunities to speak and present. That's a part of our community and industry and relationship building. We can't do what we do without organizations like this working with us, creating those opportunities for those small and diverse suppliers. Especially now, you know, we used to travel the country, now everything's virtual. So we've had to get creative in how we wanted to work with different national organizations across the country. Communication and program branding, that's branding our Supplier Diversity Program. This is our 20-year anniversary. We're part of the Big Dollar Roundtable. And we want to work to really get the word out about what our program is and how our program is growing, and look at benchmarking off other programs and continue to prosper what we have. Then we look at our supplier development and education. That's mentoring suppliers, working with suppliers. That's we have a Roger Williams University executive learning series where we're partnered with Roger Williams University. We bring in, I think this year we brought in 20 suppliers to be a part of the program. Actually, they're in the middle of the program now, last until October. They work with CVS coaches. They work with Roger Williams University administrators. And it's all catered around their business, how to make their business grow, how to stay economically viable. It's different modules. We have our construction business building event, which just was completed in July 30th, working with our general contractors across the country and creating opportunities for subcontractors. And we also have coming up here in a few months is our Supply Diversity and Merchandising event. And that's where we bring together our merchandising team and to give merchandising suppliers an opportunity to present to our merchandising team. Last year was our pilot program. We had 18 merchandising suppliers come in. It went to 6, 6 went to 2. And I think out of 2, both of them are in some of our stores right now. So it's a great program that gives you an opportunity to actually sit down in front of our merchandising folks and present and give you a chance to get your products in some of these 10,000 stores that we have. So this is kind of what our program is right here. It's these 4 pillars. It's the basis of everything that me and my team do. It falls in these pillars. And this is what supports and runs our program. And this year's been a little different. We had a lot of grandiose plans for 2020, and they kind of got put on a halt, and we had to kind of readjust some of the things we had to do. We had to get real fluid in how we're doing things, and you know, we had to learn how to operate in a virtual world, and at the same time, maintaining our Supplier Diversity Program at a very high level. So it was a learning experience, and we've done great at it. This is the basis of what we do. So when you're looking at, you know, who we're partnered with and what we look at, some of the advocacy councils that we're involved with across the country. As you see, attend events being hosted by national and regional advocacy groups, access to different databases across the country, then, you know, your outreach and your engagement. and development of diverse suppliers. We're part of the National Minority Supplier Development Council, NMSDC. We're part of WeBank, which is the Business Council, Disability In, NGLCC, NVBDC, and I think we're about 2 or 3 other local and national organizations that we participate in. These are partnerships that we need when we're looking for diverse suppliers, and we're hosting events. They help us with the talking about our events and being a part of these different events. Relationships like the event today, which I'm very honored to be a part of. This helps us continue to develop our program. It continues to help us get our word out. Without these advocacy organizations and councils, I couldn't do what I do. They're a big part of what CVS does, and we will continue to prosper and grow and help these organizations prosper and grow and continue to be a part of them. So for everybody that's out there, this is kind of how to connect with us. We look at our Supplier Diversity, our team inbox, Supplier Diversity at cvshealth.com. That mailbox is actually monitored by my team. Diverse supplier registration portal. So we have a registration portal, which if anybody is a diverse business out there, you have to register someplace. Connexus is our portal. You see CVS Health myconnexus.com, myconnection.com. Our CVS Health Supplier Diversity website. You go on that website, you can find the economic impact report. You can find more information about our Supplier Diversity program. You can find out if we were traveling, where we're going to be at, what conferences we're going to be at. That would be on there. And then our CVS Health Suppliers website. That's where our website for our suppliers. And then you can actually go back to the where it says See Supplier Diversity to the left. And that's they kind of work together. So that's kind of where we are, how to find us if you need us. Again, platforms like this are great because it gives us an opportunity to meet suppliers and to network. So I want to thank you for the opportunity. I want to thank you for letting me speak today. It was truly a pleasure. And I look forward to hopefully seeing everybody in person one day when we're out of the virtual world, I guess. Thank you.
Thank you, Tom and Keith and CVS for your leadership, in particular, all of the work you're doing around COVID-19 testing and your social justice strategy, your supplier diversity. It's all incredible work. And as I mentioned at the beginning of this infocast, Agenda Fair is really thrilled to partner with GMDC and providing its members with support, whether it's around assessment or acceleration of diversity, equity, and inclusion, but also in bringing these type of organizations and innovative practices and best practices to light through stories and through experience, that in hopes that others can learn from and implement in their own organizations. So thank you for having us all, GMDC, and I look forward to any questions that anyone may have.
That's really great. Thank you, Jose. Thank you, Keith. Thank you, Tom. That was really great information, very timely, very appropriate for everything that we see going on today. So we really appreciate that. We do have some questions. So I'm looking at the clock. We do have a few minutes at the top of the hour to go ahead and take them. Let's start from the top. Our friend at Hallmacher, Dave Wenlin, and also a GMDC member is asking, is it possible, could you share ways or metrics that CVS is tracking to gauge progress and success? And then how's that shared across the organization?
Keith, you want to talk about supplier diversity, and I can just pick up after that?
Mm-hmm. Yeah, for us, we track it. We have reporting that we do from a tier 1 standpoint. We report, and from a tier 2. That's how we track our progress. Of course, being a part of $1 billion roundtable, we're audited every year to make sure that we're doing what we say we're going to do to make that number and to stay there. We also track our progress now, especially we have our supplier diversity goals, which are set at the beginning of the year, and actually they may increase again next year. So we track our progress through a lot of reporting of the numbers quarterly. We report quarterly, not only nationally, but also internally. That's how our progress is tracked on what we're doing, as well as goals throughout the year. We also track from our construction team it's a part of the contracts that are out there that our general contractors have to spend 10% with diverse suppliers. So that's how we track our progress on the supply diversity side.
Tom.
Yeah, and from a corporate perspective, with our social justice strategy, we're in the process of developing a diversity scorecard, which will incorporate each of the 4 different parts of our strategy I mentioned: the supplier diversity, addressing health disparities and social detriments of health, colleague and corporate culture, and then workforce initiatives. And so those metrics, as we're defining them right now and taking what we already have, is they're going to go ahead and build in, I anticipate, to our corporate social responsibility report, which we send out every year. And if you're interested in seeing a little bit about the breakdown in terms of representation, people of color and gender in particular, you can go to our cvshealth.com website. In social responsibility, you can see our last report for 2019.
That's great. Sam is asking, how has your supplier diversity budget been impacted by COVID-19, or has it been?
Yes, it has been impacted.
I would think so.
Yeah. Once we went through this, it was a company-wide impact, but supplier diversity, our budget was cut considerably because money was being pushed towards, testing centers. And so we had to, again, be real fluid, real innovative, and real strategic in, how we used what we had left. And knowing we had 3 or 4 big events that we want to do our own and still participate nationally at different events. So it has impacted us, but we've gotten very creative in how we're going to do things. And right now we're looking good so far with 4 months left in the year. So hopefully I'll get everything back come 2021.
Tom, do you have anything to add? No, that's enough said. We all know our budget. We all see that. Yeah. I'll see that budget forecast come across every week, every month.
Angie is asking, what does supplier diversity look like for CVS Health moving forward? So, Keith, you've done a really great job as far as helping us understand all the access and kind of the regulations and the best practice that you guys have put into place. Where does it go from here? I think CVS is one of the leading retailers in this area. So what does that look like in the future?
That's a good question. For now, for us, it's really going to be based off learning to not only strive, but survive in a virtual world. Because with us, it was a lot of, you networking, and you guys know you're traveling, you're meeting folks in different, in different places, and that's how you're meeting new suppliers. And so now is more of going forward is how can we have our matchmakers virtually? What organizations can we be tied to or reach out to meet these new suppliers, to get them in front of us? We're looking at merchandising events. How can we work to find out what merchandising suppliers are out there? So right now, my team has been real innovative and creative in that direction. I think, we're ending this year out that way, but I think a good portion of next year, we're still going to be doing a lot of things virtually. So I think from a supply diversity standpoint, it's really going to be having that virtual platform. And I think also having the support from our C-suite leadership and saying, hey, we'll give you the platforms that you need to be able to continue to move, continue to be fluid. I think, when we're looking at our pillars, our pillars can be there in 2021. We just may have to think differently in how we want to still achieve our goals. But I think going forward, supply diversity is going to be really good. I think there's a lot of opportunities out there. I think we just got to remember that, in the midst of everything we've got going on now, our social justice team that we have here, and just all the social injustices that are going on just externally, that we've got to make sure we're creating those opportunities, not only for African-American community, but we're also creating those opportunities for our LGBT community, our women-owned businesses, our veteran-owned businesses, that we're finding and creating those opportunities and making sure that we're still putting the products on the stores in the communities that we're in and that our stores are in, that they see that they have the commitment, not only from CVS, but commitment from our supply diversity team. So I think going forward, we've got some work to do, but I think we're positioned ourselves already to achieve a lot of those goals.
That's great. We have, looking at my clock, we have time for one more question. Tom, I think this may be for you. Gordon is asking, will you be expanding the footprint to other locations for the walk-up testing?
Great question. We're looking at those opportunities on an ongoing basis, and you know, as you see in the news, the struggle for PPE, and you know, the private-public partnership, and some of the bureaucracy that goes along with that. We can't roll them out fast enough, or as much as we would like, but certainly we're looking at different ways, you know, as with working business to business, and other ways in the community to be able to help impact and control this epidemic. And eventually be able to provide vaccinations.
That's great. Jose, Tom, Keith, thank you once again. We're at the top of the hour, and we do want to let our audience go, but we greatly appreciate your time. Jose, we look forward to this ongoing partnership that we have with Gender Fair and trying to help all of our members really understand what this is about. And if there's ways that we can help them engage with Gender Fair through our portal, we're more than happy to be of assistance. So thanks again to all three of you.
Thank you for having me. Appreciate it.
So back to our audience. If this is your first time experiencing a GMDC Infocast, I'd like to make sure that you're aware that this session and all previous Infocast events can be viewed on our archive tab on gmdcconnect.org, along with a schedule to register for future Infocasts. We have many more exciting ones coming up, including a brand new series that we're already well into called The Brave New Retail World by our Retail Tomorrow Advisory Council. Some really great stuff there, especially as we continue to help retailers navigate COVID-19. I'd encourage you to get involved with GMDC Retail Tomorrow and become a member if you're not already. Remember, today's Infocast is just a small sample of what members have access to. GMDC is a nonprofit retail-owned association that helps us connect you and companies to growth, to opportunities in general merchandise, health, beauty, wellness, and self-care industries. For more information, please feel free to contact me at markm@gmdc.org. I'd love to help you find opportunities and get your companies exposed to high-profile executives and decision makers that can truly change your business. Thanks again for joining us. We hope the rest of your week is as productive as this last hour has been. Thanks again and take care.